Welcome to the Thursday edition of Ask the Expert with Dr. Walter Tom. Welcome. Dr. Tom is the medical director for Dr. Tom Cosmetic Surgery. drtomcosmetic.com. Let's Stay Young Together. Nominated and won Best Cosmetic Surgeon
Yes.
and esthetician, Dr. Tom, 8 years in a row.
We're so excited.
Congratulations.
And thank you, Michelle. Everybody, thank you so much and for voting for us. We're really lucky that we've been accepted so well into our community. Thank you, everybody. We appreciate it.
And we appreciate you, and we aren't us without you. So thank you for listening. And we have a guest in the studio, Dr. Walter Tom, who is your surgical assistant, Karina.
Yes.
So nice to be back.
Karina's becoming a fixture here now on our show, which we love, and Ask the Expert on KSRO. So Karina is really a wonderful person to be here today because we were going to talk about breast augmentation, and cosmetic breast surgery in general.
Right.
And in this particular show, we wanted to talk about the postoperative care and what patients need to do. And Robin, you and I were chatting about this right before the show, and you were basically making the comment of how important that is for patients to protect their investment.
Well, indeed it is. I mean, if you're going to make some kind of forward movement on, enhancing yourself into something, I think people think about for many, many, many years. Maybe not, but I think before you do it, you're thinking about it. And then you do it, and it's a lot of money, time, and investment, but you want to be sure that you're protecting that investment.
Absolutely.
Now, how do we do that?
I think that's really important. And Karina, Robin made a point about talking about cosmetic breast surgery, that patients think about it for a long time. Would you agree with that comment?
I do. I do think that a lot of the patients that come into the office have been contemplating surgery for a while, and now they've made their choice, and they're here. So it can be overwhelming for them with everything that we tell them to do before, and sometimes the after maybe can get forgotten about. Yeah, I'm just excited to be there, and then they forget that there's still an after can happen.
Right, and a perfect point. You are correct, both you and Robin and Karina, in that women are usually thinking about cosmetic breast procedures for years. And so a lot of times if they're mommies, it may be 5-10 years.
Well, sure, they're busy.
We're doing cosmetic breast surgery on women in their 50s and 60s who've always wanted to do something, whether it's an augmentation, might be a reduction, it may be a lift. All of those kind of, thoughts about trying to enhance themselves and regain their confidence, if you will. They're thinking about it for a long time, and as Karina said, they're so excited. They've been waiting for 5 years, 10 years.
I just want tomorrow.
And then they want it scheduled like tomorrow, right? And so that's where
I can say that from a personal experience coming into the office and waiting for, I think I waited like 6 months for my consult because that's how busy Dr. Tom was at the time.
Well, you have the COVID restrictions in place, and I know that you're still very careful, correct? I mean, excuse me, I don't think I'm speaking out of turn. I mean, you have a great presence and a great medical practice and protocol, and we appreciate that.
We do have protocols, and it's important, and as Karina had mentioned before, Karina is our very coveted cosmetic medical and surgical assistant. So she helps me both with patients pre and post-op, as well as assisting in surgery. And Karina had just mentioned that originally she was a patient of ours. And that was really very kind of her to share her experience. But it's important. She admitted that she was just so excited to have it done. She wanted it done. And you really don't think about the after. And that's where it's so perfect to have someone like Karina who's been through it with us as her team.
And your niche is under local too, which is very different.
So we do all our procedures under local, correct. And so she's able to then educate the patients, because I'm going to backtrack for a moment. One of my colleagues is a really good orthopedic surgeon here in town. And when people make a comment to him about the fact that he gets good results, he thanks them, but he also says, you know what? You need to thank the physical therapy team. He says it's because of the rehab and what they do afterwards that enhances and optimizes their results.
That's full
And I
circle.
will tell you that that's absolutely the same for cosmetic surgery. So we spend a lot of time going over postoperative care during the pre-op period,
Yes.
right? And of course, most
Her
of the
eyes got
patients,
really big.
most
This
of the
isn't radio.
patients, because they're normal, how much of it do you think they retain?
It's just so much information in one sitting.
Right.
That's the thing.
But I'd rather have it be more than not enough.
100%.
So, and then I always encourage them to call us. If you think of anything, before your surgery, after this appointment, just give us a call. Anybody can, assist you or guide you through
Any
whatever questions you may have, because you do, when you're in the moment, you may forget to ask your question, or you didn't write
trepidation.
things down, or you go home and you think about it, wait, can I do this? So it's important for our patients to feel welcome to call and ask. And
Well, plus once you do it, I mean, let's say, you finally decided to do it, whether you're in your 40s, 50s, 60s, 70s, 80s, whatever it is,
Right.
30s, you have other obligations.
right, yeah.
So in the midst of trying to care for yourself, you have all these other things going on. So let's walk through what are the important things that we should think
What
about.
are the
So-
important things? Yeah.
As we do that, Karina, let's first talk about just a very short amount of time. By the way, if you're wondering, why are they talking about post-op? Because what about all the pre-op information and all? We covered that in a previous show. We covered that with Bridie Burke, who's our other medical and surgical assistant, and she was here. Karina was supposed to be here that day, but was ill, so
Yeah.
caught probably a cold from her two little beautiful kids.
Yes.
And
Gosh,
so
love
it was Bridie and I, and that is on another recording that we can certainly
Sure,
show a
just
link for
link it
that
up.
as we hope to post this on YouTube and our website.
Right.
But what I wanted to do today was just talk a little bit about the procedure for about 5 minutes.
Okay.
And then let's jump into the post-operative care, because that's where I heavily rely on Karina, I'm in communication with the patients. I talk to
are.
them
You
for the
call.
first couple of
You
days.
call
Yeah,
right
I call them
after.
the night
Yeah.
after surgery,
do.
night of surgery, excuse me,
Yes.
and each morning. But really, when I call, they may not have all their questions kind of in their head, and so they have to feel very comfortable calling our office and speaking to our staff. And Karina, having gone through it herself, besides being a very intelligent young lady, is able to give our patients really in-depth instruction and guidance. So, Karina, just for a moment, why don't you just kind of summarize what happens on the day of surgery?
Thank you.
On the day of surgery, or
Yes.
before,
Yes.
on the pre-op?
On the
On the
actual day of surgery.
Okay, what do we do? What's happening?
So on the day of surgery, the patient's coming in, usually around 8 a.m., and they have all their medications with them. They're ready to go. The nurse is the first point of contact for them. So at that point, we're saying, hi, welcome. Let's go to the restroom. Let's get you situated. It's a fun day. It's going to be great. Of course, people are nervous, so we want to be sensitive. And really, it's patient tailored. So if they're really excited, we're excited for them. If they're nervous, we're a little bit more calming and soothing and that kind of stuff. And we're there really early as a team, setting up for surgery.
They're really early as a team. I'm
Or
kind
you're
of
just like
waltzing
walking in.
in. I'm
Now the truth comes
the
out.
I'm the hefe walking in. No, I get there early too. I get there early too, but not as early as our team.
But us,
goodness.
Bridie is the other scrub tech, and the nurse Heather, we're there since early to prepare for the patient. And so when they get there, they get all dressed and changed, and they get their medication on board, so they're nice and relaxed. And then Dr. Tom comes in, and he goes over once again what we're doing. We really review once more. This is what we're doing today. We verify sizing, all that good stuff. More pictures. We've taken tons of
pictures,
pictures.
yes.
More pictures,
Always
really?
pictures,
Oh,
yeah.
man.
And any last minute questions that they may have. So, and once we get into we ask them, what kind of music do you want to listen to?
Are you serious?
Oh
right
yeah,
now? Michelle.
something that's nice and relaxing though, because we have had
No
we want
Metallica.
relaxing.
Yeah, okay,
we want
yeah,
relaxing.
Right.
So, what do you want to listen to?
Occasionally play Bad Bunny, but most of the time
That would
it's
be my
relaxing.
choice.
That would be Karina's choice, exactly.
But we want to keep it relaxed. So whatever is
Thank you.
calming and soothing to the patient. Our bed's nice and warm. So we do all the things to make it as comfortable as possible. And I think Dr. Tom does a great job on kind of asking the patient, do you want me to let you know what we're doing, or do you want us to let you go to sleep?
Be quiet. Sure.
Be quiet.
Sure.
We will let you know what we're doing. We won't go in depth if you're nervous. So again, patient tailored. What can the patient handle? What are they comfortable with? And then we go into the OR and we start our day with the patient, and we take time, and that's
take her time.
Them and us, and that's all we're worried about for.
There's rumors that there's foot rubs and head rubs too.
There is most definitely head rubs in the OR, and Heather is our expert in that.
That is
and
correct.
Foot rubs, most definitely. Yeah, they get pampered.
So we pamper the patient, and obviously
Yeah.
we're doing that on purpose because we're doing this under local technique, which the benefits offer quicker recovery, much safer for the patient, and actually less postoperative discomfort, as well as less postoperative problems with infection and bleeding. So it's really a great technique. We complete the procedure, and so we're not going to go into that so much, Karina and Robin. And so we've completed it. Everything is all in place. Patient gets to see themselves. We take photos. They get to look in a mirror at their end result.
Right.
I would just love to see their faces after they get to see the results.
It's actually very heartening to see how excited they are. Right.
Yeah. Great.
It makes me feel
And so we do that, and then we're getting the patient ready. And so, do they have to wear a surgical bra?
Yes.
Oh, they do.
We do.
Okay,
So
after.
why don't
have
you
to
tell
have,
us
like,
about the
compression.
surgical bra?
Okay, so it's kind of so the surgical bra is something that is part of the postoperative care, or surgical garment for most of our surgeries, but specifically
It's like
for
a
breast,
compression
it's a
type of
very,
thing?
let's say, I would compare it to a very heavy duty sports bra.
Got it.
Very heavy duty.
Okay.
And it's clasped in the front, clasped on the top, and in the back there's clasp. And they do order that ahead of time, and that's instructed in the pre-op, and we have it there ready for them. And we put that on there. The instructions are you have to wear it for 2 weeks at all times.
Okay.
Right? Unless you need to wash it or you need to shower.
Sure.
Hand wash and dry. So we even go into that. How can you take care of your garment, right? We pretty much give a lot of information.
More better.
And then after the 2 weeks, we usually advise the patient, now you can transition into a sports bra. No underwire bra for 2 to 3 months.
Okay.
As long as everything looks good. If there is some sort of opening or anything like that, then that may extend the need for the bra or the need to push out any underwire garments.
So the important thing is, again, following our directions, and we make them not just to be pedantic and say this is what you have to do, but it's really going to give you the best result. So the compression bra is going to hold if it's an implant, hold the implant in place, allow swelling to go down. It's going to facilitate the swelling to go away more quickly, to resolve more quickly. If you've had a reduction or a lift, it's going to help to support the tissues while all the surgical repair that we've done and suturing is able to heal. So it's all very important. One of the things that we do recommend for patients is icing. It's amazing that our patients require, because it's done under local, and the local anesthetic does last for some time, that they tend to require less pain medication or less narcotics. But an important part of that is icing. And so what do we have them do for icing?
What's the routine with that?
So for icing, we say the first 48 hours is the most important, or we find that may provide the most relief for the patient, discomfort-wise. So icing on and off, in
20
intervals of
minutes
15 to 20 minutes. Keep, whether you make your ice pack or you buy your ice pack, whatever it is you do,
we have a frozen
keep
peas.
a few, frozen peas. I tell that to patients. Frozen, whatever your choice is, just make sure you have backup so you can switch back and forth as needed. Always making sure that they're not icing directly on the skin to prevent ice burn, because that can happen. That is a great thing to do. Wrap it in a towel, or even a pillowcase is always better,
Pillowcase is perfect.
because
Pillowcase is
it
perfect.
kind of allows you to feel the coolness without, towels can sometimes take away from that cool effect
Seemingly
that we
a
want.
little bit thinner.
A little bit thinner.
Yeah.
So that is important for the patient. And then after the first 48 hours, and you're kind of getting back into doing things, really icing as needed, or maybe at the end of the day, maybe a week or two out after surgery, you had a really long day, you were a little bit more active, You can ice still. It doesn't stop there. So
So keep it up.
You
Kind of
can
keep
it up as needed.
Right.
Exactly.
Yeah.
Yeah.
What about the sutures? Are the sutures dissolvable, or
So,
does it depend?
The sutures that we use are dissolvable. There's no external sutures at all, so there's no sutures to be removed. We do reinforce them with what we call steri-strips, which are little butterfly tapes, which help to hold the incision to kind of reinforce it. We actually allow, if we see the patients in the first 24 to 48 hours, I am in contact with them, as I mentioned, the night of the procedure and the next 2 days, but we will see them in 24 to 48 hours.
After.
Once we've evaluated and make sure that they're healing well, everything looks good, there's no problems, they can actually take a shower. So they're actually able to take a shower right away. We do ask, and probably the biggest issue that we run into with, I'm going to call it non-compliance, just not following it, is that
Daisy.
everybody thinks exactly that, hey, I had it done and I can go out and do anything I want.
Sounds like you. Excuse me.
Right, it might
Calling
be,
you out.
but I mean, we've had patients where, you're on medications and so forth, when they've driven themselves into the office on the very first or second day.
Oh, no.
And I mean, that's a testament to how well they're doing and the procedure, but it's not the wise thing to do.
Right.
I understand.
So you
Okay, that's
have
fair.
to, if you're going to have this procedure done, please arrange to have somebody be there with you for the first 48 hours, okay? You can be up and walking around. You can sit at the dinner table and eat, but you
Right.
really need to take the time in the immediacy in order to have an uneventful recovery. And I tell
Take
people,
care of yourself.
I like that.
exactly,
Uneventful recovery.
take care of yourself at first, and your full recovery is going to be shorter. You try to get into normal activities or even push your activities too soon, you're going to lengthen your recovery. So these directions are put together
Yes.
for a reason. And as I mentioned, I had a patient who drove her. I have several who've driven themselves in, and part of it you can say, well, look how good she's doing with the surgical ego, but actually that's not good.
Right.
They need to take care of themselves.
Right.
In fact, most of the time, if we have a problem, it's related to somebody trying to get back to work too soon.
Oh, is that
Right.
right? Is
Back
that
to
right?
work
Or
or
active.
They're just
other
go, go, go,
activities,
go.
right?
Mhm.
Yeah.
Yeah, that makes
And I do feel that all of this is done at the pre-op, right? So we're going over how to take care of yourself when we're seeing you and telling you what to do before. So sometimes it can be easy for a patient to just listen to what am I doing before, right? What am I doing before, but not what I'm doing to after. So
Right.
I do think that we give them written instructions. So I always say, this is your little to-go folder, and it has what to do before and it has what to do after in case you forget or you're wondering. So we give it to them in a few forms because I do think people pick up things differently. People learn differently. Some people like verbal, some people like written examples. So we kind of give it to them in many forms,
Which is good.
to
And
help that aid that. I think.
May I dovetail into that and
Yeah.
say maybe the person that's looking after you the
Yes.
48 hours could also have that information.
We do.
So that
They
okay.
actually get
Yeah.
that information. So
Okay,
Robin,
good.
We
and
give
we're
that
recording, so I'm not
information.
sure how clearly that's
Yeah.
coming across on the recording, but Robin had definitely made the comment about having the caretaker have that information.
Exactly.
We actually have them sign a sheet
Oh, you
when
do?
we
Yeah.
give them
Oh,
that
wonderful.
information. And today's show, our listeners out there, and thank you to our listeners in Sonoma and Napa and Mendocino, Marin counties who are listening to us. We're actually videotaping this show
Yeah.
because we're going to put it on YouTube, and that's all part of our educational process. And I want to thank you and Michelle, Robin, because you're helping us with that. We're going to be putting this on YouTube, putting this on our website, and we're going to actually use that as something that I text my patients as well as soon as we're done, so they have my number, and I'm going to text them this link so that they can now watch it, or their loved ones who are taking care of them can watch it and understand what we're talking about.
Right.
So we'll kind of summarize a few things about that, but that's really a big part of what our show is today. Is it's education, and trying to get that across, because most patients are more focused initially, especially if we're talking about just breast augmentation, is how big do I want to
Yeah.
be? That's that's what they're thinking. How big do I
A lot
want
of
to be?
factors. It's a lot of
and we're
Hey, we can't help
and,
it.
we're
You're excited.
and we're saying
Hey,
call
it's true.
call
As a patient, it's very true.
right. You're kind of saying, okay,
Well, you're a
we're going to
patient
help
and
you.
the assistant, the surgical
I'm a
assistant.
patient, so I can definitely,
You
from
get it.
being the patient point of view, it when I try to educate, I try to be the patient, but also the person that, you know, is in the procedure and gets to see a lot of this happen, because that's what I do. That's what I do for work. So I try to take those things into consideration when educating the patient. To
Imagine that having had the experience and explaining it.
Exactly.
Yeah.
So, but I also try not to say, oh, I've had this done, to take away from their experience, to validate, you know, because everybody's experience is a little bit different and unique. So I do like to bring that up and say, hey, I've had this done too. I'm a great source of information, but it's different for me and it's been different for the other ladies that I've had do it. So it's good to have all the different views and how all these women have had their experiences. And I always tell them, I say, I'd rather prep you for the worst and have you say, oh my gosh, she was a liar, this was a breeze, this was a walk in the park, I'm in no pain, than to say, oh my gosh, nobody told me I was going to be in this much pain.
Right.
Yeah.
I'm so proud of Karina.
Did
I hire the right person or what? I'm looking, you know, again to our listeners out in Radio Land and KSO Radio Land. I'm actually talking to my phone now as we're videotaping this, but boy, I'm going to pat myself on the back a little bit because did I hire the right person. And I love the human,
because I
just
love what I do.
very
I love this.
generous way that you hear Karina speaking about our patients. So in terms of just, I'm going to summarize, Karina,
Yes,
and
summarize.
I'm going to summarize a little bit about what I expect the patient to do. You know, that's the surgeon's perspective, and then I would like you to kind of then add to whatever. I won't use the word correct. I'm going to use the word add. Okay, remember I still am the jefe here. Okay, so yeah, I gotta pull that every once in a while out there.
Okay.
So you know, the patient has their surgery and they have the garment placed, and so hopefully they're having minimal discomfort when they leave, and we walk them out to the car. We actually walk them out.
You don't need a wheelchair.
Walk them out to the car. They're not driving home, but you know, somebody's
No.
driving them home, and then we tell them. As soon as they get home, what I like them to do is get a big baggie and fill it up with ice. Karina's suggestion about putting it in a pillowcase is perfect, so it protects the skin, and then basically building an ice castle around or mound around the breast area, whether it be for breast augmentation, breast lifts, or breast reductions. That's going to be key for helping to minimize discomfort. We do have the medications that we've written. We have anti-nausea medicines. Most people don't experience nausea like patients who have general anesthesia do, okay? So it is very rare, but we write for anti-nausea medication that they're taking around the clock for the first 48 hours. We actually have pain medication, 2 types of pain medication, a non-narcotic called gabapentin, and then a narcotic called oxycodone. We definitely have them take the non-narcotic gabapentin, and then they supplement with the oxycodone as needed. And I'm going to tell you, if it's breast augmentation, and especially if the implant's placed under the muscle, it's more uncomfortable. There's no getting around that. So they may need that, and I'm not trying to make them feel guilty about that. They take the medication as they need that. They do take an oral antibiotic for a week, okay, so we're going to have that, and this is all written down for them, and it's gone over that with the patients. Basically, in quadrupled, triplicate for sure. And so that, and then I ask them to just take it easy, you know, sitting upright to help to minimize swelling. They can eat really whatever they want, although we ask them to start off with a light meal.
Is it best to sit up while you're sleeping when you're the first 48 hours?
I always advise, well, our preference is that if they can be in a reclined position.
Okay.
If it's not their first time having this procedure, if it's a redo or anything like that, most patients can tolerate laying on their back.
Okay.
But I say expect to be reclined.
Okay.
For your comfort, and lots of pillows. Always
Lots of
under
pillows.
under the arms.
Who doesn't like lots of pillows?
Behind your back, under your knees. If you have those travel pillows, those are great because you're sleeping and your neck is just be cozy. Little cocoon is what we tell them. Your little cocoon.
And the key is a continuing ice, and so your care partner is going to be tired. He or she, when we see them the next first 24 to 40 hours, they're going to look tired because they're putting that on every couple of hours, okay? And so that's going to be important. Definitely hydrating, so drinking lots of fluids is going to be important. We're going to ask you for the first 48 hours, to be like T-Rex on Toy Story. So
Okay.
you're kind of,
Now, what
you're
does that
think of
mean,
your
really?
arms close to your chest, and all you can do is move your forearms, okay? So
Yes.
you're going to kind of do that, and then after we see you, we're going to allow you to increase your activity. You can actually wash your hair afterwards, and
How
over
long
the
before
next
we can wash our hair?
after
48?
24 to 48 hours
24 to 48.
after they've
That's
been
an
seen
important
by
thing.
us.
I mean, come on.
And so I know we have a little less than 2 minutes left here. So just finishing up, what we're going to do is you're going to increase your activities. We'll let you know. You can usually resume aerobic activities in about 3 weeks, weight training at about 4 weeks. You're going to wear your surgical garment for 2 weeks. You're going to wear a sports bra or no underwire garment for 3 months. Then you're going to go to an underwire garment after that.
Okay.
And
And
then
why is
after-
that? You just because it's tender?
We're trying to protect the incision site,
Okay,
so
yeah.
we don't want any underwire for that type of procedure.
Makes sense. Okay, that makes sense.
We can't, yeah.
And how did you feel, Karina, when you got done with it?
With my personal
Yes,
experience,
if you don't
oh
mind.
my gosh, I was not prepared. For the discomfort. I mean, I was prepared and I knew what was going on, and I said, I have 2 kids, this is going to be a walk in the park, and I was not prepared, and I was definitely a lot of pain. And I tend to be tough, so it was a real eye-opener that this is surgery. This is a
Right.
big
And that's
deal.
important. That's what
And
you're
that's
talking
actually
about.
the advantage
Exactly.
having Karina is because she didn't really embrace the post-op.
Yes.
So
Oh,
she's even going to be
naughty
more
girl.
right. It's like the ex-smoker, right? Now she's zealous about really informing the patient.
that's
I just
so
didn't know
that's
what
the way
to.
to
I
do
didn't
it.
know what to expect. So
Right.
It's valuable.
creating those expectations for the patient is great. Yes.
Thank you so much, Karina, for giving
Thank
us your
you.
personal experience. And Dr. Walter Tom, thank you as usual for your, navigating us through the waters. We appreciate it. You're going to come back next week? Are you going to hang with us?
Sure.
Absolutely. Bring her
Anytime.
back
I
as
love
much as
being
we
here.
can.
All right. Thank you, everyone.